4 o'clock. So generally a lot of good news from our COVID update today. Let's start by showing the map. This was updated by the CDC on Thursday. And look at that. For so much of this pandemic, our map has been red virtually throughout the state. On good days or weeks, it might have been orange, and we were lucky to have a couple of yellow counties. Look at all that green. The top line today is while we still have some struggles, while this pandemic is still with us, things continue to move in the right direction, and they are continuing to move at a regular pace. That means cases, positivity rates, all declining, as well as hospitalizations, those in the ICU and those on ventilators. Every metric is moving the right direction, and this map is just one way to show how we are moving to a better place. Let's remember, we were moving to a better place when Delta was receding and then Omicron hit. So we've got to be humble in that we are not finally through the pandemic yet, but we hope we are well on our way to being through with it. This Thursday evening, when the CDC updates these numbers in this map, we expect to see a lot more yellow and indeed a lot more green, especially in central Kentucky, which we expect will be yellow or potentially green. Remember, Franklin County, I think, went straight from red to green, and the direction that we are seeing everything move is a good direction. So last week, because we now just have weekly reports, 9,532 new cases of COVID-19. That's down from about 12,000 the week before it. Our positivity rate, talk about a great number, now down to 4.17%, continuing to decline. So when we show in a minute our stair-stepper charts, the decline in cases is continuing, but it's not as pronounced as the decline in positivity rate, which again we think is the leading indicator, while the cases themselves are the lagging indicator. Before we get to the stair-stepper chart, one concern is that deaths are still high. Some of this is reports still coming in from January and February, but this continues to be the deadly virus. 283 deaths last week. That is comparable, if not a little bit higher, than the week before. And it continues to kill people far too young. Just this last week, a Boone County man, 49 years old, an Estill County woman, 43 years old. Louisville got hit hard, losing a 25-year-old, a 32-year-old, two 35-year-olds, a 37-year-old, a 42-year-old, and two 49-year-olds. 47-year-old man in Lawrence County, and a 47-year-old woman from Lincoln County, a 42-year-old woman from Mercer County. So again, the pandemic is receding, but the death toll is still significant. A lot of families still struggling. Let's make sure we continue to pray for them, but to also to work to get more people vaccinated and to ultimately not only see the other metrics continuing to decline, but ensuring we don't lose anybody else to this deadly virus. Let's look at the stair-stepper chart. And we are now 1, 2, 3, 4, 5, 6, 7 straight weeks of declines. As we get lower, obviously it becomes a little bit harder to have that decline, but still, almost 3,000 cases. And the decline this last week to the week before is more significant than the week before that. Remember, that was due to a holiday, government holiday on the Monday. So we think that would be a more regular downward curve. But for that, no reason to think that we won't have fewer cases this next week than we had this last week. Let's look at the positivity stair-stepper chart. Again, same number of weeks of a decline. You actually see a more steady decline here because the positivity rate is not impacted when there is one less day. It's still that average percentage. So that is showing a continued positive downward trend. The positivity rate is now below where the decline stopped in Delta before Omicron hit. That's a really good sign, certainly, to me. Even better sign, look at the line graph for hospitalizations. Right now, below again, the Delta / Omicron valley, continuing to go down at a significant pace. That's what we want to see. We really want to see these get down to where we were before Delta. And that was last summer. And right now, it looks like we are headed in that direction. ICU, the same, continued downward trend. In fact, that one is moving down at a faster rate than hospitalizations. But remember, Omicron hits you differently than Delta. And we didn't have as many people in the ICU as Delta, even though we had similar levels of overall hospitalization. And the same with ventilators. That one may be the fastest one that is going to get down to last summer levels. Again, a wonderful sign. If there is one metric that is going the wrong direction, it's vaccinations. Though we had more vaccinations, I think, this last week than the week before. We had 6,459 Kentuckians last week choose to get vaccinated for the first time. In other words, to get their first shot and start that process. We had 8,045 get their second shot and become fully vaccinated. We had 10,809 Kentuckians get boosted. Again, there's something positive to those numbers, even though they're less than we'd like, and it's that they are not necessarily declining week to week. We've always hit a point when we are at the valleys of infection or hospitalizations where fewer people have gotten vaccinated, but the fact that it continues at some steady rate, even if it is a lower rate, that's a piece of positive news that we can take out of that. We've had some change in our demographics, which we always show. Overall, right now, 2,894,264 people have had at least one shot. The overall percentages haven't changed. That's 65% of all Kentuckians. It's almost 2/3 of all Kentuckians, even though some aren't eligible. It's nearly 70% of everybody that can get a shot has gotten a shot, and 76% of those that can make their own healthcare decisions. So the top two haven't changed. Really, 65 and up has done a really good job of getting in and getting vaccinated. We would like to see that 75 and up increase a little bit more, given they're the most vulnerable. And when you look at deaths of vaccinated individuals, it shows that age group really needs not only the vaccine, but the booster. Everybody needs really at least those 3 shots. Up one on 50 to 64, now at 82%. 40 to 49, unchanged all the way down to 16 to 17. And we've gone up 1% there, now to 52%. Let's remember, all of these in the red are areas where really with just a push and the family conversations, we can do a whole lot better. And this is the area where if we could improve our vaccination rate, we would likely lessen the spread of any future variant. And hopefully that would mean that it would be less likely that a future variant would hit us. Age and vaccine status of COVID-19 deaths, James, just wanted to reinforce that while we are seeing those deaths that I read out in younger Kentuckians, they're virtually all statistically, they're all unvaccinated. When you look at this chart, it can tell you a couple different things, but what it says is if you're vaccinated and under the age of 50, you do not die from COVID-19. And really, statistically, if you're under the age of 60 or even close to 70, you do not die from COVID-19. If you are unvaccinated, you certainly have a possibility of dying from COVID-19. Couple more points on this. The first is currently in the budgeting process, certainly our recommended budget continues using about $160, $170 million of ARPA funds for COVID mitigation. I think the Senate version has $0 going towards continued COVID mitigation. Not sure I recall exactly what the House has. Without additional dollars in this budget for COVID mitigation, because remember, we're learning to live with it. It's not disappearing. We would lose, without additional COVID mitigation dollars, we'd lose the ability to do a couple things that I think it's important for people to know. Number one, we could not support the test to stay in our public schools beginning this fall. We think with where things are now, we can get through the end of the school year, but we would not have test to stay funding for the beginning of next year. And what that could mean to the number of kids that would either be in school or at home would be significant. The second, remember in the first special session, the General Assembly asked us to set up regional antibody centers with, these are monoclonal antibody plan. We could not afford to continue that without any dollars to do so. Third is community-based COVID testing. That's where we can use gravity diagnostics in UK to boost testing in areas where it has been needed. Remember when we had a push on the hospital, one thing we did is set up off-site testing locations so people weren't going to the emergency room. So that means if any area even had a spike in Kentucky, we would not be able to come in and help them with more testing. Long-term care facilities. We wouldn't be able to continue the critical testing there for those that are around our seniors to do everything we could to keep COVID from getting in the facility. Remember, this is the age group where the vaccines really help, but at the same time, even vaccinated, if COVID gets in a facility, it can cause a lot of harm. And finally, PPE. I mean, it was 2 years ago. I was standing right here saying we didn't have enough PPE for our folks to walk into a COVID wing and be safe. Not having these dollars would hurt our ability to stock the 90-day PPE emergency supply we have. We have sent that out over and over and restocked it. That ensures our healthcare heroes and others in long-term care, when the supply chain crunches or has problems, that's when we are able to step in. We would no longer be able to do that. So listen, this isn't about any restriction. There are no restrictions. There have been no COVID restrictions for 6 months. This is about us being able to support things like testing and PPE and actual treatment if you get it. Given that the pandemic in some form is still going to be around and some people are going to keep getting sick from it, it would make sense to have a little bit of money out there to help keep them alive and to help keep our nursing homes safe. All right. One other topic today. I want to give a quick update on tornado relief. Last Friday, I was happy to travel back to Mayfield, this time for a hopeful day, celebrating progress and healing. As you know, the people of Mayfield and several surrounding communities witnessed one of the most horrific nights in December that anyone in our state has ever had to endure. It was the worst tornado event of our history, an F4 staying on the ground over 200 miles, nearly wiping out cities, taking over 80 Kentuckians from us, more than we have ever lost in any tornado event. In the aftermath, though, even after the darkest of dark nights, people saw Kentucky's strength and compassion. They saw neighbors opening their hearts, their homes, and their wallets for one another. And the whole world saw that we here in Kentucky do not break, and our Western Kentucky brothers and sisters are as tough as they come. After the storm, I pledged that we would rebuild every structure and every life. So on Friday, I joined local officials to help bring that day a little closer in moving some additional Kentuckians to medium-term housing, here travel trailers to 3 Mayfield residents. All right, these ladies are Linda Witt, Sandra Egner, and Glenda Glover. These are 3 friends that all lived right around each other in the same community, that we were able to put in 3 trailers all next to each other. In other words, their friends, their support system from before is going to be here in this facility. That's one of their travel trailers behind them. This comes with the help of $15 million from the General Assembly. Together with them, we created the Commonwealth Shelter Program. We purchased 200 of these trailers. Right now, we have 43 households, 159 individuals occupying 44 of these travel trailers. Go back one. This lady spoke a few special words. She said she was, I think, 82 and said Mayfield's her home. She doesn't want to have to move. This is a special place to her, and this was going to let her stay there. This is the very least that we could do for her and her friends and everything that they have been through. So Friday was a good day, and today is an important day. It's the last day to apply for FEMA. Today, March 14th, is the last day to apply for FEMA. You can apply by going to disasterassistance.gov, by calling the FEMA hotline. Just please file a claim. So many other forms of help are tied to you filing a claim. And you can also go to governor.ky.gov/tornado resources. That's one word, to see everything else that is available. All right. So with everything in COVID moving the right direction, after today, we are going to pause our Monday COVID press updates. And I'm going to hope that pause becomes permanent. But I once said we were having our last update. And given that I really want this to end up being the last one, we're going to make sure we refer to it in the right way with whatever superstition helps us get where we need to get. And we're going to say we are going to pause them. We're going to continue with our Thursday Team Kentucky updates. We may provide COVID information at that time. We will also have our reports put online on Monday that'll have all the same information that we have had to date. So with that, we'll open it up to questions. I think we have 3 journalists here with us. We'll start with, we have 3 with questions. We'll start with Karen Czar.
I have 2. You touched on this just now, but to expand this a little bit more. It's a very different feel in here today as opposed to almost a year ago when these briefings were going to stop. Talk about a little bit more about that change. And then also, there have been concerns, especially in my county, Fayette County, amongst parents who say we're never going to get out of the red because our hospital capacity is now included in that CDC number. Can you reiterate the importance of why that's being included and when you anticipate things will shift for counties like that?
Oh, Fayette County, I fully expect to be out of the red this next week. We'll see as the numbers come in. But remember, it's also a large county. And you got both a numerator and a denominator when you're looking at those numbers. There are also multiple factors that the CDC looks at. And you could say the same about Jefferson County and the number of hospitals it has. It's currently in the green, not in the yellow, but in the green. So to Fayette County parents, hang on. Franklin County was there, I think, just a week or 2 weeks ago. Remember that schools are actually the congregate setting with the least amount of vaccinated individuals, but it's coming, and it's coming soon. And I believe your school system will have done the right thing to get to the safest place with those children. It does feel a little bit different than last year when we were stopping these, in that we just know that there is a possibility that we see a new variant, and we need to be ready for it. I'm asked at different times if I could go back in time and change a decision or a way to talk about things. And after I mentioned Tupac, I really would have talked about how this was going to be a war. Now, none of us had lived through it before, so we didn't know. But I would have talked about how you don't win a war in 2 weeks, that a war may take 2 years. And that's what it's been. And this war will end when we beat the virus or it becomes fully endemic. And we'll only know that's happened probably weeks to a month after it's happened. But we are wiser, not just than when we started this, but where we were a year ago. We know so much more about the virus, how to fight the virus. It's become, in many ways, a part of our daily lives, even the things that haven't been disrupted about, do I choose to wear a mask? Where am I going? Who else is there? When do I need to get my boosters? So that's a part of it becoming endemic and living with COVID. But I just want to repeat, if today is the last update we give, living with COVID is not ignoring COVID. It is having the information to be empowered to make the right decisions to protect yourself. Mike Valenti.
So if there are new variants that emerge, like the sub-Omicron variant,
Mhm.
in Europe, and this truly becomes endemic, do you anticipate holding cases when we see those peaks and valleys, see a high wave
Yeah.
in Kentucky?
Yeah, this is given that this is a pandemic and it's taken so many lives. If we have other peaks and other surges, I'll be right back here. People need the information, and remember, Omicron was a little different than Delta, and Delta was a lot different in what it was doing and what we needed to do to respond. We are not certain or even sure that any of the variables out there will necessarily have an impact on us. Here in the United States, levels of vaccinations can be so different. So there are a lot of pundits out there, but we never know exactly what we're going to get right until it's here and until it's impacting us. But we're gonna provide information in many ways. What goes on the website, what we can do on social media, and when needed, these press conferences. And to the press, let us know what you need moving forward, because we want to make sure we can get the word out on important topics. Bodie?
So I have a multi-part question concerning Senate Joint Resolution 150. The public has received that to you to prematurely end your COVID state of emergency. Firstly, do you plan to take any action on that, whether that be veto, no action at all? Also earlier this afternoon, Senate President Cybers released a statement on SDR 150 addressing concerns shared by some Democrats about the SNAP benefits, and I'm curious if you have a response to that.
Yeah, Senate Joint Resolution 150 is politics at its worst. It will take food off the tables of more than 500,000 Kentuckians, most of them struggling seniors and struggling children. The federal government is currently providing these extra benefits because COVID hasn't just hit us in terms of health and infection. It has impacted supply chains, which have caused the price of food to increase. So that struggling family is currently paying more for the same amount of food than they were before the pandemic. If we don't have these extra benefits, we are providing less in terms of how much food people can get than we were prior to the pandemic. Every time we have talked about extending the state of emergency, we have specifically talked about disaster SNAP benefits with leadership in both the House and the Senate. CHFS talked to the health chairs of both the House and the Senate about this impact. Ending this state of emergency, cutting $50 million worth of food to our people is wrong. And for what? There are no restrictions, no COVID restrictions in Kentucky, none. And there haven't been for 6 months. So they won't remove one restriction because there isn't any. They won't do anything for individual liberty because there isn't a restriction out there. And there can't be under the extension orders that the legislature has granted. All they'll do is take food off the table of struggling seniors and struggling children. My faith tells me that's wrong. You know, one of the most important miracles by Jesus is the fishes and the loaves. I've read that text numerous times. I've sat through dozens of sermons on it, and I've never, ever heard Jesus turn someone away who was hungry in that story. Never. These are dollars flowing from the federal government. We don't pay 1 penny of it here in Kentucky to get the extra help. And I, for one, certainly think our struggling kids and our struggling seniors ought to have enough food. So you'll likely see some action on that a little bit later this week. Jessica Payne from the Murray, Ledger, and Times. Congratulations to the racers.
Yes, go Racers. I have two questions, if that's okay. My first one is current guidelines on when hospitals can drop universal masking aren't very clear. In your opinion, should hospitals still continue to require universal masking? And if so, at what point do you think that it would be appropriate for them to drop that? And then my other question is, are there any plans to implement wastewater testing throughout the state so that we don't have to rely so heavily on people getting tested? Thank you.
So on the second piece on wastewater testing, currently we do that at our prison facilities. It's proven incredibly effective at finding COVID infection early. It's a proven method. Louisville has also done it. If we don't have additional funding, like we talked about in those bullet points, that type of testing, just like other types of testing, the state support will ultimately end. We may have the dollars on the correction side to continue to do it there, but with the funding and in the right plan, right? It's got to be regional. You have to have the right plan there. Wastewater testing can be incredibly effective. On the hospital side, remember, people who are sick, people who are sick because of COVID go to a hospital. The workforce is absolutely critical, and the spread of this virus can knock so many of them out that I think all the hospitals are right to continue universal masking. There's most of what they have to abide by is from the federal government. And I certainly think as long as we have COVID, the levels that we have right now, masking in a hospital is just smart. Tom Latek, Kentucky Today.
Thank you, Governor, and good afternoon to you. I have a two-parter as well. First of all, are we seeing stealth Omicron in Kentucky, and if so, what percentage? And what is the point when we change from pandemic to endemic?
We are not seeing any substantial amount of sub-Omicron in other states. They aren't seeing it infect beyond where Omicron is. So in other words, if Omicron was infecting a certain amount, they are not seeing this one in many other places do more than just take some of the cases away. But I know here we are not. The pandemic to endemic is something that a lot of people are talking about right now. Tom, none of us know what that looks like. None of us know what the moment that it moves is. If it becomes something like the flu, where we get a couple shots each year or a shot a year, that might be endemic. But I think we're going to take more weeks and more months to get to that point. Certainly 286 reported deaths last week. I think it's hard to call something endemic that did that in just 1 week. April Rickert, WFPL.
Thank you very much. I also have two, if that's okay. One is not related to COVID. Have all National Guard troops been called off from helping at hospitals yet? And are there any other de-escalation plans in place, like closing any testing sites provided by the state? And second, there are several bills in the State House which could restrict abortion in Kentucky. Could you say at this point whether you plan to veto any of these if they pass? Thank you very much.
Thus far, I don't believe any of those bills have been enrolled and reached my desk, so we will review them at that time. What I have repeatedly said is I will veto any extremist bill. And by that, I mean, I've fought for justice for victims, especially of rape and incest as Attorney General. Those are people who have been harmed more than most of us could ever imagine. And I believe those individuals deserve options. National Guard today, I believe, will be out of all of their facilities. So that mission is ending. Now, the federal government has granted for several more months the ability, if we need to call them back up, to do so. But they are, I think today would be the last day that any of them would be in our hospital systems. Now, we always stand ready to help our healthcare institutions. And let me say, our National Guard has done a phenomenal job. They walk into a hospital, and they walked in the Delta surge when not many hospitals had a lot of hope. They were seeing far too much death and didn't have enough people, and the morale totally changed. That very day they showed up to help. So I can't thank the National Guard enough. I'm so proud of them. They have done incredible work. Debbie Yetter.
Hey, Governor. So on the subject of Senate Joint Resolution 150, Senator Stivers put out a statement today saying it wasn't the legislature's General Assembly's intent to impair any benefits, and also saying that if you needed something, you should come to him. So I wondered about your thoughts on those statements, and did your previous comment mean you're going to veto it?
Well, it certainly sounds like someone saying they wouldn't have robbed the bank if the security guard had stopped them. I mean, that's pretty silly. I mean, we've communicated as directly in the extensions the last time, no, early in this session when the legislature agreed to extend. Therefore, extending the executive order is necessary for emergency SNAP allotments to continue, as was the case last year when discussing extension of the executive order prior to and during the special session. It's been really clear in all the discussions that if the state of emergency isn't extended, the SNAP benefits end. That's been a part of every negotiation we've been in. Certainly all of those that we have been negotiating with understood that, and it was directly in front of them. So listen, there is no way, to our knowledge, and we've had all our lawyers look at it, that we can get that additional $50 million of food assistance to struggling seniors and struggling kids without the executive order I signed being extended. And if they end it, the law that they passed says I can't sign a new state of emergency on COVID or anything related to it. So, you can expect that I will take action. And if I veto it and they decide, at that point, it's just deciding, right? Override a veto, end $50 million of SNAP benefits to the most needy while doing nothing in terms of restrictions because there aren't any. Or stepping back and saying our kids having enough to eat and our seniors having enough to eat is more important than making a political point. It is that simple. There's no other facet to it. And no matter how we try to weave our way around in statements, listen, the legislature will either end these benefits or they'll allow them in the executive order to continue. And let me just correct one thing I think I read from that statement. We asked the executive order to be extended for the purpose of getting federal funds through the end of the year. The legislature said we'll do it to the end of the session and then we will talk then. There was no agreement that this thing was going to be over in April because if the supply chain is still being hit by COVID and food prices are still way up, then we should get additional SNAP benefits from the federal government and our kids should have enough to eat. John Park, Spectrum.
Good afternoon, Governor. Thank you for your time. Just curious, is the state at all concerned about the potential for another surge of cases on college campuses due to spring break? UK and U of L are out this week, and I just want to get your reaction on them rolling back on some parts of their mask mandates.
Well, I can understand the decisions made by the universities given the way the map looks. I'm certainly happier that if spring break for them is happening at a time when things look so much better. We got hit with Omicron later than many states, and so some of them have even less infection than we do now because they've had more time on the downward slope. So I don't necessarily expect a surge for the state or for a region in cases. It's certainly possible that it could happen just within a university community. Those universities have been pretty good about testing and their policies. and we'll expect them to respond accordingly. But listen, we're in such a better place than we were last year or the year before. So I hope all those young adults will be safe in every way, including being a little bit careful about COVID. My kids are a little bit younger than that. Spring break frightens me for the future, but we're gonna try to preach responsibility up until then. Melissa Patrick, Kentucky Health News.
Hi, Governor. I have two questions like everyone else today, but the first is very quick. Is the National Guard, using the National Guard for our hospitals, is that tied to a state of emergency? And then the second one, as we move away from, all of these to a more normal existence with COVID, there's a lot of talk about long COVID. So what's Kentucky doing to monitor or track this condition?
Yeah, so first on the National Guard, we are able to recall them and send them on various missions without the state of emergency, as long as the federal state of emergency is in effect for all 50 states. So just like I'm shooting straight with the facts about what's going to happen with SNAP benefits, we'll be okay on the National Guard as long as there is the federal state of emergency. Long COVID is something that I know the Department for Public Health is communicating with our hospital systems and other providers on. Melissa, as you all right, we're still learning so much about it, how we even identify where there has been long COVID, and sometimes how we determine that COVID has impacted other conditions, right, that may come about at a later point in time. So our methods of tracking and overall approach is still coming into focus. We've been fighting new infection for so long, but I think your question and your point is right in that yes, we're going to learn to live with COVID, but its impacts, even from what we have already been through, from the number of people who have died, which I don't think folks have even started grieving on the whole. We've never lost, to my knowledge, this many people this quickly, certainly in my lifetime or certainly in the last many decades. I think we'd have to go prior to World War II. But the overall health impacts and how significant and long lasting they're going to be, I think we're only starting to learn about. But just like our ways of treating COVID in the emergent situation evolved so much from doing things in the beginning of the pandemic that might not have helped the patient because we didn't know. We were trying everything we could to now, some monoclonal treatments that have incredible results. I do hope and I do expect that we will get better at identifying long COVID and finding treatment options there as well. Alex Akisto from the Herald Leader.
Hi, Governor. Why haven't in-person, face-to-face visitations between inmates and their families resumed at all Kentucky correctional facilities? I know that several of us have heard from people who haven't been allowed face-to-face visits that aren't through plexiglass windows since the beginning of before the pandemic. So just wondering why those are still halted and what you plan to do to make sure those visits are allowed to resume. Thanks.
Well, the first thing I'll need to do is get sufficient information to give you the right answer. We certainly should be moving in that direction, and let me check into it and get you a response. We all know the challenges that are faced there, right? It is a congregate setting, more so probably than any other congregate setting out there. And certainly the spread can happen very quickly. But we are certainly moving towards a place where we ought to be able to have more normal visitation, probably depending on where we are within the region and at the time. So let me determine exactly where we are and get you a response on that. But my commitment to those incarcerated individuals and their families is as we move to a safer place, you ought to be able to have a more normal interaction. And last, Corinne Boyer.
Hi, Governor. If another surge happens, is there any way to avoid hospitals becoming overwhelmed, staffing shortages, and deaths? Or is this something we should just expect because of slowing vaccination rates? And then I just want to make sure I understand your position on abortion. Would you support a bill restricting abortion universally as long as it had an exception for rape or incest? Thank you.
Now, my position on the bills going through right now is is that I certainly believe that anything that people are working on ought to have options for those that have been harmed. With that said, no, I'm not committing to support any of these bills. We'll review each of them. I've had a pretty clear record in the past. I don't think anything's changed from then to now. I believe that healthcare decisions should be between a patient and their doctor. But I want to point out how extreme a bill can be when it would make a 13-year-old girl impregnated by a violent act from a father or a family member potentially have to get their permission to have options. Point I wanted to point out is that's pretty wrong. And I think most Kentuckians don't agree with that. All right. Last question was on the COVID piece. What I'll say is I do think we've learned more. I think from a staffing standpoint, we are better prepared than ever before. We have a better trained guard. We have more and better relationships between nursing schools and hospitals. So I don't think that depending on the variant we get, that we will see the same levels of infections, deaths, or hospital capacity. All right, Karen, you want the last one?
No, I thought you forgot to do that.
Okay. Thank you all very much. We will now pause our Monday COVID press conferences, hoping to never have to unpause them. Thank you all.